This is Coronavirus House Calls.
And hello, I'm Art Franklin, and welcome to Coronavirus House Calls. In this Nexstar digital program, we'll spend the next half hour with a panel of esteemed medical professionals from around the country. They're here to answer your questions about the coronavirus pandemic that has put life as we know it on hold. Let me show you who's on the panel. First, we have Dr. Jorge Rodriguez, an internist, gastroenterologist specialist, and HIV researcher. He's based in Los Angeles, California. Also joining us is Dr. Markley Alexander, who is the president of Telerehabilitation International and a telehealth physician clinic at Harvard Spalding Rehabilitation Hospital. She's based in Hoover, Alabama. Our third expert is Dr. Michael Sogg, the director of UAB's hospital's infectious disease division in Birmingham, Alabama. Dr. Sogg founded UAB's world-renowned 1917 clinic and is on the Presidential Advisory Council on HIV/AIDS. Dr. Sogg is also actively battling coronavirus. Fortunately, he's feeling well enough to join us today. We will get to them in just a moment. Now, here at home in Birmingham, Alabama, we've already been answering questions from our family, our friends, and our neighbors. And we know how important it is to have accurate information because knowledge is power. So we decided to meet with you in the best place where we can all practice social distancing right here online. So America, let's get started. And we'll do so with some questions we put together, and then we'll have our panel answer your questions. First, let's talk about the virus itself, as it seems as if this is a virus that's moving faster than we can respond. It's a novel coronavirus. So at this point, we really don't know how COVID-19 behaves. So let's go ahead and turn to Dr. Sogg if we can this morning. So paint a picture for me about this virus, and for you guys are on the front lines, and for people at home, Dr. Sogg, you're actually dealing with this virus. Tell us how you're doing right now. First of all, how are you feeling?
Thanks very much, Art. And it's been, though, 2 weeks almost, and it's a nasty bug. The virus starts off very gently. It doesn't just come out and hit you like the flu. It eases into illness with some cough and malaise and feeling bad, a little bit of headache, and then it progresses over a couple of days. In my case, I thought it went away about a week ago Wednesday, and then boom, that's when the fever hit and the shortness of breath started to dance with me a little bit, and that got me a little bit nervous. But it's the last 2 or 3 days I'm starting to turn the corner, so I feel a lot better.
On the mend right now, because you were saying at first, I saw some of your interviews on television, that you didn't have the fever, but you eventually got the fever.
Correct. And I think what that is biologically, what's going on is once the virus takes hold, then the immune system starts to react to it. And the immune system has a way of talking to itself through something called cytokines. And those cytokines, when they get released in large amounts, are what really causes the symptoms of fever and feeling bad and muscle aches and that type of thing. And it's really the out-of-control cytokines that really put people in the hospital at the end of the day.
Dr. Sogg, can you tell us exactly what we're dealing with as a world, because this is a pandemic that's affecting everyone?
This is something none of us have ever experienced in our lifetime. The 1918 Spanish flu epidemic is probably the closest that comes to what we're experiencing now. The virus was originating probably out of some markets in China, but where it came from doesn't matter so much, because once it got out into the human community, no one had immunity. Nobody had ever seen this particular virus before. So unlike flu or even the common cold, a lot of us in the community have had one of those diseases, and therefore it's not every single person who gets infected once they're exposed. In a pandemic like this, every individual is susceptible, and there's no so-called herd immunity, meaning other people have had it, and that prevents it from getting as widespread. So we're fighting against a virus that is can be fairly fatal, more so than even the influenza virus right now, but ridiculously contagious. This thing is very easy to pick up. And so for my case, I was doing everything I knew to do to keep from getting it and still got infected, which is why I think the stay-at-home orders are precisely what we need right now to bring this under control.
While we're dealing with that stay-at-home order, we're finding that the United States is now #1. More coronavirus coronavirus cases than any other nation in the world, including China. What stage are we in and what's next?
Well, we're still in early stages, unfortunately, and it's really a question of how well we as a public honor this stay-at-home request from most of our governments. And even if your government hasn't said, in your municipality, stay at home, we should be staying at home and only going out if it's essential. China has a lot more people than we do, yet we already have more cases, even though it started there. The reason they got it under control is that they hung down, locked down. We haven't been that disciplined. And so until we get everyone complying with this notion of staying at home, only going out when it's essential, we're going to be continuously ravaged by this.
Dr. Rodriguez, if I can turn to you, can you tell me anything that as you watch what we're dealing with, what are some of the biggest challenges that we've got to overcome right away to get a handle on this?
Well, I think Dr. Sag hit upon it. One is making people realize that this really is a very serious illness and a very serious epidemic. If you don't have the experience of it, I think there are two types of people. One is the ones that tend to upplay it and are fearful of almost every symptom they have, and then the ones that tend to downplay it. And those are the ones actually that I think are most at danger and are the most dangerous. So if you're a healthy person, young person, and you hear that this is only, for older people, we're doing those people a disservice and we're doing the community a disservice. So what I'm running up against is trying to inform people of how serious this can be. For example, I have a gentleman who's at home that we have proven, that he has the virus, and we follow him every day, but he's still coughing and he's still having some fevers. And what he asked me is, can I please go out and take a walk? All right. So the reality of this illness hasn't set in because we don't have the experience of this illness. So that's why I think there's so much confusion and sometimes so much hesitation to follow the recommendations because it's brand new.
It's brand new, but if you look at the number of cases in this country, people should start seeing the reality at this point. Let me turn to our first viewer question. It comes from Robert and Kimberly in upstate New York, and they ask whether children with divorced parents should be traveling between homes or during this pandemic. That is a question coming from Robert and Kimberly in upstate New York. Any one of you guys, go ahead and jump in and give us an answer on that.
I would comment on that.
Go right ahead.
I think it's, that is a decision the parents are going to need to make based on how the child is doing. In practical medical terms, yes, it would be better not to have the child go from place to place because of the potential transmission of the virus. But the reality is that every family situation is different. And so I think the parents have to work together to make the best decision.
Dr. Alexander, thanks for your question there. I think Dr. Rodriguez was trying to jump in as well. Dr. Rodriguez.
Yeah, I don't know the answer. And ideally, if I were to be a purist, I would say that it'd be best if the child and the parents decided on one parent for the child to stay with, so that there isn't, I'm conflicted about what I'm calling pod, or families. For example, I have friends in New York, very close friends, 3 couples. They all live in the same building. They're quarantined, yet they have dinner together. And I'm wondering whether that is something that even should be done. So if you trust the pod of that family unit, then I think maybe it's safe. But I think classically, if you wanted to be completely safe, in my opinion, that child should probably stay with one parent. But like Dr. Alexander says, there are a lot of emotional and psychological issues that need to be taken into consideration.
There are a lot of concerns also, to the 3 of you, about the ability of hospitals to be able to treat their patients. They're talking about running low on supplies, especially those ventilators, which are really needed to fight this virus and to help people recover. So many hospitals trying to also prepare for what's coming next. How bad do we expect this to get, and what should we be doing now to prepare for that?
Well, a lot of hospitals are already responding. Several have been in preparation mode for 4 to 6 weeks before this thing started to hit in a big way. But yet, it's hard to prepare for what's called the surge. That's that bump in cases that happen all at once, and that's what we're experiencing right now. The thing is that every hospital only has so many ICU beds and only so many ventilators. And even though there's only 20% of people who have this virus who get sick enough to go to the hospital, once they get to the hospital, about, 30, 40% will end up going to the ICU. And that doesn't sound like a lot to begin with. But if you start talking about in a community, thousands of people being infected, and you start doing the math, we end up with hundreds of people who are needing ventilators, and then that number grows. But the other thing to remember is that once they go on a ventilator on day one, they don't come off on day two. They stay in the unit in that bed for up to 7 to 10 days on average. So the capacity rapidly gets consumed. And so the concern is that where are we going to put people once they come in and they need the bed and they're there? But the other part that I think everyone needs to realize, it's not like the rest of the world stops simply because there's coronavirus. There's still people who have trauma or burns or a heart attack or other things that are going to bring them to the hospital where they're going to need an intensive care unit bed. Where are they going to go? And so this is something, while we have to prevent that surge, that big bump in cases, which is why public officials, at least on the state and local levels, have been pushing hard for a stay-at-home order so that we minimize the chance of spreading this infection rapidly through the community. We take it over time as opposed to all at once. And that's really essential to keep the hospital systems from being overwhelmed.
And then, Dr. Alexander, when you talk about those in the hospital, we're talking about people on a ventilator who needs to be on that ventilator for a long length of time. So we're talking about days, perhaps weeks, they may need that ventilator. So that's really the concern with those supplies, right?
That fact that people are on ventilators is the one thing, but I think, as Dr. Sag had mentioned, we've also got to realize that people also still have other medical problems. So if someone comes in with an acute stroke or another issue, we've got the challenge now of determining, okay, is this problem related to COVID or is it related to their underlying issue? And for instance, with people with spinal cord injuries, which is a group of people I work with, there already have been cases where the individual is sick with one problem, but they also have an underlying pulmonary problem. And so teasing out what is related to COVID is something that's very important. I think, though, as we also think about all the patients in the hospital beds, we've also got to realize that we do have to care for the general population. One of the things I've already seen is repurposing of beds used for people with disabilities, for instance, rehab beds for acute care beds. So that's necessitating a change in how we care for patients. Hence, the telerehabilitation piece and telemedicine piece has quickly exploded in terms of doctors utilizing this service. And what's happened is actually the government has relaxed the rules. It used to be that people needed to have a HIPAA system in order to talk to patients via video chat, as what we're doing right now. And that rule has been temporarily relaxed. So that is one thing the health system is doing to help people. And I think over the next few weeks, we're going to see this more and more, because there is no reason that a individual should be taking the risk of going to a physician's office where they might see other people that have COVID and spreading the disease that way. That time before you get symptoms is so long, and that's what's different with COVID, that there's many people that may have it but not have the symptoms yet. So we've got to be very careful. The other thing I need to mention that Telerehab International that I work with is not at all related to Harvard. You made that connection in the beginning. I need to just say that.
All right, thanks for clearing that up.
But I think over the next few months, we will see a change in practice. And I think we should be pleased about this, because people will actually find that this can be beneficial for them and save them time and waiting in doctors' rooms, et cetera.
Yeah, that really works out for a lot of people. Dr. Alexander, I want to put that on hold for a second. I want to move out to California before getting to our next viewer question. New York, epicenter here in the United States, our nation's #1 city, #2 city, hospital ship, Navy ship off the coast of California, getting ready to help out there. What's the concern in the Los Angeles area? That are we going to see another explosion like we saw in New York?
Well, yes, of course we're concerned about that. I think in a way, what Los Angeles is criticized for sometimes is what may save us a little bit, and that is the fact that we are a car community. We don't have subways. We don't have mass transit used in that capacity. So basically, I'm not saying that it's going to be easy here. It already is not. But the density of the population that you see in New York, the fact that millions of people are shoulder to shoulder multiple times a day, I think is contributing to that. Whereas our car community here may be something that does not cause the surge to be as quick, but we are predicting that over the next couple of weeks, we are going to be seeing the same surge. So yes, we are concerned. One of the things that I think has been our advantage is the fact that for the past 3 weeks now, we have had the stay-at-home orders, both from the city, from the governor, and I think they have been very proactive and are even being more proactive, closing down parks. And, it's just difficult for people to understand that staying at home and being what I call physically distant as opposed to socially distant is what's important. So just the fact that you're jogging in a park next to two people, that's still very risky. People are huffing and puffing and, spitting and, so that doesn't cut it. So just because you're in the clean air. So yes, we are as concerned as New York. Absolutely.
That perfectly gets us into our next viewer question right now. This comes from Julie in Beaverton, Oregon. She asks, if my husband and I have completely self-isolated for 2 weeks with no contact at all with others, including going to the grocery store, and my children, grandchildren, and 92-year-old mother have done the same, at what point can we get together as a family, continuing the same isolating plan after visiting? Dr. Saag, you want to take that?
Yeah, that's a tough call. I think it probably still is best to maintain the distance throughout. What I would do is I'd filter everything, all these questions, I would filter through the lens of, is it essential? Is it essential that we come together again? And sure, it's desired. It's actually what a family is all about. But right now, especially for 92-year-old mom, not essential to get with her. In fact, it's harmful. Because even though we don't know that we might have picked something up, even at the grocery, you go, you get the cart, you put your hand on the cart handle, and then you accidentally touch your face, you picked it up. Or you go pump gas, you get it off the gas handle when you're pumping your own gas. You don't realize that. And even though you've been really assiduous about staying at home and washing your hands, it may not be enough. The virus is very, very contagious. And so we have to take all these extra precautions. It's sacrifice. It is sacrifice, but I think it's sacrifice well worth it because our country's been invaded. We're at war against a virus. And just like the Brits had to hunker down in London during the Blitz, they had to change their behavior where they were getting bombed by the Germans. We're getting bombed by a virus. And we have to change our behavior, at least for the short term, to protect not only ourselves and our family, but our entire community.
Dr. Saag, thanks for that. I want to ask the panel about our nation's response to this coronavirus pandemic, specifically in our response to conducting testing. Have you watched the response? What could have been done differently, or what should we be doing at this point? Dr. Saag, since you're up, let's go ahead and start with you.
Yeah, well, we didn't prepare well, to be very honest. We had signals from China in December that something was happening. By December 31st, for sure, there were reports coming out that said there was a potential pandemic brewing. And we go through the entire month of January, and we don't get any political leadership on this. I'm not saying this to be political. It's just a fact. We did not take ownership of it as a country, and we didn't jump on it. The CDC then went and developed its own test. They distributed it, and unfortunately, the test was flawed. WHO and other countries offered tests to us. We turned them down. And I think in retrospect, those were all mistakes, that we should have been more accepting of what other people had to offer us, and we should have been a little bit more on top of our game. That's been rectified now in a lot of ways. Commercial labs and several others now have tests, but we lost a precious 4 to 6 weeks when we really needed the test to get this under control. But in a lot of ways at this moment in time, that's water under the bridge. But I think lessons for us to learn for the future pandemic preparedness.
Let me turn to Dr. Rodriguez. What should we have done differently then, Dr. Rodriguez?
Well, I think Dr. Sag brings up a great point, that this is a lesson learned. I think preparedness is the key. And I'm going to continue using the same analogy. Just because we don't know the enemy doesn't mean that there are not enemies at the border every single day. I used to do a radio show, and every time we would always talk about viruses attacking this country, because if you look with a broader lens of what's happened throughout the world over the past 50 years, it has been viruses that have basically decimated tens of millions of people. All right, whether it's Ebola, whether it's HIV. So that is something that we need to realize is a very real and imminent threat that could happen at any time. So governments going forward, and even from this time right now, have to realize that we need to be at the ready. That the people that know these things need to be respected, their opinions need to be listened to, they need to be funded at a point where they need to be ready immediately. We don't have the luxury sometimes of 4 to 6 weeks. So what can we do? I think we can respect the science, we can fund the science, and we can be at the ready for future pandemics that are probably going to be happening regardless of what happens with this one.
Dr. Alexander, same question to you. Let you weigh in as well.
I think that one of the things that the U.S. could have done better too was getting the healthcare workers tested and prioritizing testing of healthcare workers. I know colleagues in Norway, all the docs in the hospital were tested, and it turned out that the majority of docs were actually positive and many did not have symptoms. So we have been limiting the testing because of the lack of the tests in the US, and I think we've got to start being prudent. And as the others have said, listen to the scientists, listen to the people that really know what's going on and what is important. And I think this is the time we have to realize that our health and our society need to think about health first this time, and more so than economy, actually. The other thing I just want to mention in terms of the families getting together, one of the things I think people don't realize is that if you do end up in the hospital, most hospitals are not allowing visitors. So not only will grandma be in the hospital, she will be alone. And if on a ventilator, you won't be able to see you and she won't have the comfort of seeing you. So we do have to take this seriously, because if you do end up with that loved one in the hospital, it's going to be so much harder for you, not only in terms of the disease, but emotionally.
On this question of testing, and we're seeing more and more people get tested. What about some of the rural areas and some of the underserved people in the community? Are they getting the tests? And as we see these numbers go up, is it only because we're seeing more people get tests, or is the virus spreading that fast?
Yes. I think it's probably a combination of both. I think more tests are available, therefore we are seeing more reports of people being positive. I also exponentially in my practice know that more people are coming down with the virus, so I think it's a combination of both. I think you bring up a great point, which is underserved areas probably are going to be surging, exploding, if you will, with this. If you take, for example, in my experience and Dr. Sag's experience, HIV as a model, right now it's the southern part of the United States that before this had the highest number of cases, probably because it's underserved, probably because of lack of access to healthcare. And just a poor part of the country. We're probably going to be seeing that happening just because of all of those variables coming into play. We're seeing it now in Louisiana. Of course, there was Mardi Gras and there was a big configuration of people, but probably where these two distinguished doctors are right now in Alabama, Mississippi, Georgia, Florida, we're going to be seeing probably a surge of that. This is just not limited to the big cities at all.
Those rural areas.
The other thing I think is that the virus, to get the virus actively, it depends on how much of the virus you get into your system. And the more likely that is going to be is how close you are to other people. So the populations that are very dense, yes, we're going to see those populations have the big peaks now, and as we're seeing in New York, where they're testing more people. People in the communities in the distance, yes, they're going to be less likely to get it because they're around less people. But this combination of the testing, the population density is an interaction that is going to transpire over the few months as we see the virus go to different places.
As we talk about this virus, one question that has come up recently is, those who have recovered from the virus, can we get antibodies from them and then use that to help other patients?
Well, that's something called antibody therapy or convalescent serum therapy, and people are talking about it right now. I've been already contacted by NIH and a couple of colleagues here at UAB to donate my serum and some B cells as I get better, and I'm happy to do that. I'm hopeful, though, that the convalescent serum would only be a short, something that we would only use for a little bit of time, because I'm hopeful that some of the therapies that are being tested will actually turn in some positive outcomes. They're under review, under evaluation right now. So maybe by May or so, we might start seeing signals about some of the newer therapies. But that's something that's been used in other viral infections with different degrees of success.
And Dr. Rodriguez, as we also looked at them using various medicines for HIV/AIDS and trying to work that into the battle against coronavirus. What are you seeing in that area, and do you think that might be helpful?
I think that bench research right now has some things that are interesting and promising in the laboratory. And I think those of us that do media sometimes on television, and the fact that there needs to be a story out there, can do a disservice to the general public, which is by disseminating information a little bit too quickly. For something to be available, for something to be useful, it has to be tried, and it has to be proven that it's not a fluke. For example, everybody's talking about hydroxychloroquine now with AZT because of a study, not a study, an anecdotal case of 20 patients. Yes, when you look at those three lines in the graph, it looks very, very positive. But we don't know if the group that did better, is younger people, healthier people. So the process needs to be followed, and it needs to be followed as quickly as possible, but also as scientifically as possible. For example, right now, there's still a lot of criticism by some people that AZT was released too soon, that it killed many people. So the truth is it probably saved more people than it did harm to, but we need to follow the process as clearly and expeditiously as possible. But there are some things out there that I think are promising, and lots of things are being researched at this time, including medicines that had been used for HIV and other things.
Dr. Alexander, we've got about a minute left now. Some people they're looking for hope. Where's the hope with what we're dealing with right now?
Although this is a difficult, trying time, it is also a time to take a pause. This is a time, people may think it's hard to stay home, but this is actually a time that people can learn new methods to deal with our life's difficulties. One of the things people can start thinking about doing is meditating. Meditating is a really positive way for people to improve their immune function, to decrease stress. I think the other thing people can do is just think about taking care of themselves. One of the things about COVID is that if you get it, it's going to be important how your general health is. Your general health helps your immune system. So this is the time to actually learn to live life with a little more gratitude what you have, a little more gratitude for your family, and take this time to take care of yourself a little bit more. I think if this happens and the world takes a pause, we will actually all do better for. I think we're also going to have new methods of medical care to take us to the next phase and our future so this doesn't happen again, and that we are prepared for the next pandemic or the next crisis.
Because at some point we will get through this, right?
Of course we will. We will get through it. We will be stronger and more mature.
Dr. Alexander, Dr. Rodriguez, Dr. Saag, we thank you all for joining us this morning. Also, we want to hope that we've been able to give you some clarity in these past 30 minutes, but we understand there's more you want to know. And our discussion does not end here. You can message your local Nexstar station on social media or send an email to coronaquestions@nexstar.tv. And your questions may be answered in our next episode of Coronavirus House Calls. Stay on top of the latest updates by visiting your local Nexstar station's website. Don't forget to download their app. And most importantly, follow the recommendations and guidelines from health experts. Be safe, take care of yourself, and do your part to help save lives. I'll see you tomorrow.